Hello and welcome to this presentation. My name is Jessica Sutherland and I will be presenting my DNP scholarly project titled Improving Appointment Adherence Using Phone Call and Text Message Reminders. I would like to start by introducing and thanking my DNP committee. They have all provided such exceptional guidance and resources throughout the implementation of this project. My DNP chairperson, Dr. Jennifer Hopner, has been instrumental in ensuring the successful completion of this project. Dr. Maria Snell is my second reader and has shown great commitment in her leadership and in her students' success. Lastly, I would like to thank Dr. Rhonda Smith, who is my community member and medical director of the project site, my supervisor, and one of my dearest friends. Background and significance. Appointment adherence is one of the first steps in creating a positive patient-provider relationship. When a patient does not attend their appointment, there is a missed opportunity to connect with the patient and positively impact their health status. The interruption of care causes negative effects for both patients and the healthcare team. There is a discontinuation of care, longer wait times for the next appointment, decompensation of health, decreased patient satisfaction, and higher admissions to emergency rooms, which may or may not be appropriate. No-shows also create unfavorable outcomes for healthcare. There is a loss in productivity, lost revenue, and organizational inefficiencies. When researching the cause of missed appointments, it was found that the most common reason for no-shows is forgetfulness. Interestingly, it was found that 77.8% of missed appointments were scheduled more than a week in advance of the appointment, which could contribute to the likelihood of forgetting about the appointment. When surveyed, it was found that patients thought that a phone call reminder would be helpful in them being able to keep their appointments. Another approach that was found to significantly reduce the no-show rate was the use of text messages, especially in younger, low-income, and uninsured populations. Phone calls and text messages can be utilized to aid patients in remembering their appointments and therefore have potential to reduce the no-show rate. Purpose and aims. The purpose of this DNP scholarly project was to implement evidence-based research to decrease the no-show rate by adults in a rural primary care clinic. Prior to the implementation of the scholarly project, the project site only used appointment reminder cards if the appointment was made in person. Otherwise, no appointment reminder was given. The primary care clinic experienced a high no-show rate and was motivated to implement an intervention that would improve appointment adherence. The intervention to decrease the no-show rate was to implement an appointment reminder system that would use the patient's preferred method of contact, that is, phone call, text message, or phone call and text message to remind patients of upcoming appointments. Research question. Research for this project stemmed from the research question, in adults in a primary care clinic, is the use of reminder phone calls and or text messages more effective than only the use of an appointment reminder card to reduce missed appointments? Review of literature. To help answer the research question, a literature review was conducted. The search for current literature used Maryville University's library collection of databases, including the Cumulative Index of Nursing and Allied Health Literature, CINAHL, Medline, and Google Scholar. Advanced search parameters were set to focus the search results on the most current and relevant literature. The parameters included full text, peer-reviewed, English language, and years published ranging from 2016 to 2021. A variety of prominent themes were discovered while reading the literature. The four themes that reoccurred throughout the readings are the impact of no-shows, predictive factors for no-shows, quality improvement strategies, and reminders. I would like to take a moment and discuss each of these themes briefly. Impact of no-shows. The impact of no-shows negatively affects patient healthcare status and outcomes, continuity of care, and the overall efficiency and financial aspects of the healthcare system. One of the significant negative impacts of no-shows is on the patient's health status. When a patient misses an appointment, there appears to be a direct correlation with increased health risk that the patient experiences. Without patient care, which is caused by missed appointments, it is found that patients experience poorer health outcomes and are less likely to utilize preventative health care services. The disrupted continuity of care contributes to health conditions compounding over time to produce suboptimal patient health outcomes. No-shows also affect the efficiency of healthcare facilities where patients miss their scheduled appointments. No-shows produce a negative effect on clinical productivity. There is an underutilization of staff, equipment, space, energy, and time. The underutilization that is caused by missed appointments creates a significant problem of lost revenue in the healthcare system. To offset the financial issues that no-shows cause, many healthcare organizations increase overall charges to patients and other payers. Predictive factors for no-shows. Predictive factors found in the literature that are associated with missed appointments are issues such as forgetting the appointment's date and time, a history of no-shows, being younger, having no insurance or having state-funded insurance, low income, unreliable transportation, and having emotional stressors about medical appointments. One of the most prominent factors for why patients missed an appointment was simply that they forgot about the appointment. Forgetfulness was cited as one of the most common reasons for missing appointments. A contributing factor to forgetfulness is a long lead time to the appointment from when the patient scheduled the appointment. With forgetfulness being one of the most common reasons why patients miss appointments, it would be beneficial for healthcare facilities to have a reminder system in place to help the patient remember their upcoming scheduled appointment. Quality improvement strategies. Many of the articles in this literature review offer solutions to tackle the no-show problem, such as overbooking, a discharge policy, informing the patient of the need to attend their appointment, and communication between the patient and provider. The use of overbooking and a discharge policy helps healthcare to be more efficient, but it lacks in helping get patients to their scheduled appointments, whereas strategies that include creating more of an urgency to attend appointments and the use of different communication methods prioritize both healthcare and the patient. Reminders. The use of reminders is a quality improvement strategy that is also an important and prominent theme that was recognized in the literature review. Multiple studies had similar findings of reminders increasing appointment adherence with a significant decrease in the no-show rate with the use of some type of reminder system. Some of the studies found that phone calls had a slight improvement compared to text messages for increasing attendance at appointments. However, text messages are more cost-effective than phone call reminders and have a significant impact due to their simplicity. Text message reminders also have the added benefit of allowing the patient to look back on the important details of their appointment, such as date, time, and location, whenever it is needed. With forgetfulness being one of the most common reasons why patients fail to attend their appointments, it is clear to see why reminders would be an effective tool to help increase appointment adherence. Theoretical framework. The theoretical framework that was applied to this project was the Coordinated Implementation Model, which takes credible research and disseminates it throughout healthcare practices. The outline steps of the Coordination Implementation Model are to research information, use an effective dissemination strategy, consider competing factors, and create coordination among all stakeholders, including the patients. For this project, the information was research pertaining to the research question. The dissemination strategy was creating a policy that implemented the positive findings from the research to reduce the no-show rate. Considerations of competing factors includes considerations of other factors that contribute to no-shows, such as transportation, financial issues, health literacy, insurance coverage, or language barriers. Lastly, creating coordination among all stakeholders was the implementation of the policy of the reminder system. The application of this policy affects all stakeholders, including the patient. Methods and design. Here we will discuss the methodology and design of this project. This quality improvement project was quantitative and exploratory in design through a retrospective chart review. No patients were recruited nor incentivized for this project. The pre-intervention period was during the normal operation at the primary care clinic of giving the patient an appointment reminder card if the appointment was made in person at the clinic. However, if the appointment was made outside of the clinic, such as through a telephone call, the patient was given no reminder of the scheduled appointment. During the 8-week post-implementation period, the primary care clinic implemented this quality improvement project by adding phone call and/or text message appointment reminders. The patient information form that is normally used was revised to collect information on the patient's preferred method of contact, that is, phone call, text message, or phone call and text message. This project is also longitudinal in design as data were collected at more than one point over an extended period. The data was extracted from the practice management portion of the electronic health records of the patients who were scheduled during the pre-intervention period from October 1st, 2022 through November 30th, 2022, and during the 8-week post-intervention period of January 1st, 2023 through February 28th, 2023. Setting. The setting of this project was implemented at a rural primary care clinic in the Mountain West region of the United States. The patient population served at this clinic are Native American and Medicaid patients, who statistically tend to be of lower health status. The primary care clinic also experienced a high rate of no-shows. Sample. The desired sample for this project was 154 adult patients between 18 to 64 years of age who were scheduled between the pre- and post-intervention periods of this project. The inclusion criteria for this quality improvement project included that the patient must 1. Be a patient at the primary care clinic, 2. Be 18 to 64 years of age, 3. All genders, 4. Have a cell phone that can receive phone calls and/or text messages, 5. Agree to appointment reminders on the patient information form, and 6. Have an appointment scheduled during the 8-week intervention period. The exclusion criteria of patients include 1. Under the age of 18 or greater than or equal to the age of 65. 2. Do not have a working cell phone that can receive phone calls and/or text messages. 3. Do not agree to appointment reminders. And/or 4. Do not have a scheduled appointment during the 8-week intervention period. The pre-intervention sample size was 463 appointments, and the post-intervention sample size was 547 appointments, with a total of 1,010 appointments for this project. So, data analysis. Descriptive statistics for this quality improvement project were used to assess the appointment reminder type used based on the patient preference, that is, phone call, text message, or phone and text message. That was implemented during the 8-week post-intervention period. The sample consisted of 19%, or 105 of the appointments who received a phone call reminder, and that is represented by blue in this chart. 55%, or 299 appointments, received a text message reminder, and that is represented by red in this chart. and 26%, or 143 appointments, who received a phone call and a text message reminder, which is represented by green in this chart. Demographic information such as race, ethnicity, and gender were not collected during this project. Continuing with the data analysis, in this quality improvement project, we are trying to determine whether the use of a phone call and or text message reminder system used in the post-intervention phase was effective at decreasing the no-show rate found during the pre-intervention phase. To determine this, the data was analyzed using a lower TEL z-test for the difference of two proportions. This test determines whether the proportion of one sample is significantly lower than that of another. The z-value for this project was negative 1.9600, creating a confidence level of 95%. And the p-value for this project was 0.0000, which is less than 0.001, meaning there is sufficient information to suggest a decrease in the ratio from pre to post-test intervention. Results. The pre-intervention group, who only received an appointment reminder card if the appointment was made in person, otherwise no reminder was given, had a statistically higher no-show rate of 31.5% than the patients in the post-intervention group who received a phone call and or text message appointment reminder the business day before their scheduled appointment, with a no-show rate of 14.4%. The pie charts seen here help illustrate the significant decrease in no-shows with the use of an appointment reminder system, where the red represents the no-show rate. Limitations. This quality improvement project had 4 limitations related to the data collection process. First, there was no verification process to confirm that the patient received the appointment reminder, text message, or voicemail if they did not answer the phone call. Secondly, the option of email was not included in the preferred method of contact. Patients may have preferred to have their appointment reminders sent to their email rather than a text message and or phone call. Thirdly, data was not collected on the reason for the no-show. Variables that may cause a patient to miss their appointment include forgetfulness, unreliable transportation, financial issues, or other medical conditions preventing them from attending their appointment. Fourthly and lastly, the data collection did not specify the difference in attendance between in-person appointments and telehealth appointments. Discussion. We'll start with appointment reminders. The results from this quality improvement project found that appointment reminders significantly decreased the no-show rate. The use of appointment reminders also revealed the unintended consequence of giving the patients an opportunity to cancel or reschedule their appointments. This created available appointment slots for other patients needing an appointment. Furthermore, due to the increased need for correct patient contact information, the process of validating the patient demographics became standardized into normal practice. As a quality improvement project, there was emphasis on ensuring its sustainability. The patient information forms that are regularly used were revised with patient's preferred method of contact. The use of revised patient information form did not change the normal operations of patients filling out this form. Customized templates in the EHR were developed to facilitate notating the completion of a reminder phone call and or text message in the patient's chart. While implementing this quality improvement project required workforce and time from the staff, it was organized to be manageable amongst the employees. Due to their effectiveness, appointment reminders are recommended as evidence-based practice. Future research. I think it is worth mentioning implications for future research as well. For instance, determining the reason for missed appointments to further reduce the no-show rate. Further research could be conducted to assess the effectiveness of different types of appointment reminders, such as text messages, phone calls, and adding the option of emails. Also, exploring telehealth's role in decreasing the no-show rate, especially as COVID-19 has increased the use of telehealth appointments. Lastly, the research could explore the long-term effects of appointment reminders. The research could evaluate appointments reminders' impacts on a patient attendance rates over an extended period and the potential for sustained behavior change. Implications for practice. It can be implied that appointment reminders facilitate improved appointment adherence, resulting in better health status and outcomes. Patients attending their scheduled appointments decrease their health risk and are more likely to utilize preventative health care services. Attending scheduled appointments also minimizes the risk of health conditions compounding over time due to disrupted continuity of care. Another practice implication of this project's finding is enhanced resource utilization. Healthcare systems are affected by no-shows as there is a negative effect on clinical productivity of underutilization of staff, equipment, space, energy, and time. Healthcare organizations can operate more efficiently when patients attend their scheduled appointment. Economically, using phone call and/or text message appointment reminders can decrease lost revenue. Patients attending their scheduled appointments create monies generated throughout the healthcare system, while those who do not attend create lost revenue. To offset the lost revenue that no-shows cause, many healthcare organizations increase overall charges to patients and other payers. Consequently, patients who keep their scheduled appointments are also keeping down the price of overall charges throughout the healthcare system and the patients that utilize its services. Increased patient satisfaction could result from better health, decreased wait times, reduced healthcare costs, and efficient care. Conclusions. No-shows have a significant negative impact on the healthcare system and patients. Improving appointment adherence can mitigate the negative impacts caused by no-shows. This quality improvement project found that appointment reminders decreased the no-show rate. Therefore, to improve appointment adherence, it would be recommended to continue using appointment reminders the business day before the patient's scheduled appointment. Continued and consistent use of appointment reminders will sustain improved quality in healthcare. The positive implications of appointment reminders include, but are not limited to, improved patient health, appropriate resource utilization, increased revenue, and higher patient satisfaction. Questions. Thank you for your time. I now welcome any questions, comments, or suggestions. Please feel free to contact me at the provided email, jsutherland1@maryville.edu. Thank you. These are the references that I used for the Scholarly D&P project. There is also a QR code at the top right corner of the slide that you can scan for a full list of these references.